Hi, everyone. Thanks again. My name is Allison Rosenthal, and I am the Associate Director of the Culture of Data Committee, and I will be moderating our plenary session today. I also wanted to use this time to thank all of the other people who helped make this conference happen. That's Julia Simhai, our conference director, Rachel Mossman with the solution, and the entire Culture of Data Planning Committee who donated their time and other resources to help make this happen. I also wanted to reintroduce Rachel Massman, whose pronouns are she, her, who is managing the Zoom and making sure the tech is all running smoothly. You are all muted now, but if you have a question during the Q&A session, please feel free to unmute. You can also use the chat box if you have questions or need anything. And if you are comfortable doing so, you can add your pronouns to your Zoom name, and you can do that just by clicking on the three dots on the right-hand corner of your video and select rename. And I'm actually going to get right into the plenary today and just start by introducing our speaker and just why we chose to do this topic today. So among the many disruptions, the pandemic presented new challenges for our sector in gathering information about the state of community health, and this really complicated our efforts to offer direct assistance to communities. And with this plenary, we wanted to highlight the important role of community-based organizations in Colorado and how they adapted their community health assessment strategies to meet the dynamic and pressing needs of our community. And with that today, it is my honor to introduce our plenary speaker, Dr. Joanna Harvell. Joanna is the Director of Special and Innovative Projects at the Foundation for Sustainable Urban Communities within the Be Well Health and Wellness Initiative. Within Be Well, Joanna leads health advocacy programs in collaboration with diverse stakeholders. She leverages her background as a research scientist to think creatively, deliver project management, strategic planning, and implementation of key Be Well projects and programs, which include a focus on education and advocacy. A recognized leader in our community, Joanna serves as president of the Partnership of Academicians, Academians and Communities for Translation Council on the board of directors of Girls Inc. of Metro Denver, an organization that devotes all of its energy to bring champions for girls and the board of directors of the Regional Institute for Health and Environmental Leadership, an organization dedicated to developing and connecting leaders who work in the public health and environmental health sectors. Her efforts on behalf of others have earned her the Torch of Excellence Service Award, Irma Kelly Hudson Image Community Award, the Denver Urban Spectrum's African Americans Who Are Making a Difference Award, and the Women of Distinction Award by the Girl Scouts of Colorado. Joanna lives to inspire others to break through limiting beliefs, creatively solve problems, and achieve beyond expectations. Joanna is a graduate of the Urban Leadership Foundation of Colorado and the Regional Institute for Health and Environmental Leadership's Advanced Training Program, Healthy Community Design Program, and Coaching Academy. Joanna holds a PhD in pathology and microbiology from the University of Nebraska and master's and bachelor's degrees in chemistry from Clark Atlanta University. She is a proud member of Delta Sigma Theta sorority, a public service organization, and her favorite quote is, "You are only limited by the limits of your creativity." And with that, I give the floor to you, Dr. Harvell, to share your plenary.
Thank you. Can you hear me okay? All right, great. Thank you, everyone. Again, my name is Joanna Harvell, and I just want to thank the organizers of this conference for inviting me to speak today. I want to especially thank Allison, who has been a jewel to work with. And with that, if we could get the slides in slide mode and advance them. Thank you. So I was invited here today to talk about the work that we do within the Be Well Health and Wellness Initiative, which we call Be Well for short, and to talk about the successes and challenges our organization encountered during the COVID-19 pandemic, early on, that is. And at Be Well, we propel residents to come together to take charge of their own health and wellness and the health of their community. It is a grassroots movement of communities coming together again to take charge of their health and wellness. And we serve residents in 6 neighborhoods. And the mission of Be Well is to affect programs, policies, and practices to create health equality and access for all people. Our vision is for a culture in which all people have an equal opportunity to achieve the health that they desire. And this is regardless of their race, income, gender, or location. This graph illustrates the 6 neighborhoods that Be Well serves and seeks to provide measurable and visible improvements. And we call this area the Be Well Zone. These neighborhoods are Northeast Park Hill, Greater Park Hill, Stapleton, which is now referred to as Central Park, East Montclair, now referred to as East Colfax, and Northwest Aurora and Montbello. And residents in these neighborhoods are among the most diverse in the state, with high percentages of African Americans and Latinos. For instance, Northwest Aurora is about 57% Hispanic, while Northeast Park Hill is about 50% Black. The East Colfax population is almost evenly split among African Americans, whites, and Hispanic residents. And there are small populations of American Indians, Asians, and Pacific Islanders that are scattered throughout the Be Well zone. And so at Be Well, we uplift community solutions to advance health equity, and we define equity to be when everyone, regardless of who they are or where they are from, has the opportunity to thrive. Health equity means that everyone has a fair and just opportunity to be as healthy as possible, and it is ensuring that all people can achieve their highest level of health. Health equity practice intentionally supports policies, delivers public services, and allocates resources to advance equity and eliminate institutional biases and barriers. And in addition to our focus on health equity, it is important that our constituents understand racial inequities and how they have been manifested in society in many ways, such as through wealth, poverty rates, housing patterns, educational opportunities, unemployment rates, and incarceration. As you know, the literature from public health continues to validate that traditional medical care alone has a limited impact on overall health outcomes, while the structural determinants and conditions in which people are born, grow, live, work, and age, collectively known as the social determinants of health, have a greater impact on health status. And this includes income, education, employment, racism, historical trauma, as well as aspects of the physical environment, such as crowded living conditions, transportation systems, and access to quality of care. And with Be Well, we also educate and build awareness around the social determinants of health using training and information dissemination. The Be Well initiative is guided and governed by the Be Well Community Collaborative. And this is a multi-sector partnership driven by residents that forms the guiding voice of the Be Well Health and Wellness Initiative. The group talks with people in their neighborhoods and together sets annual goals, identifies potential barriers, and monitors the use of Be Well funds. And it consists of residents, business leaders, Denver and Aurora city representatives, elected officials who work together to build upon the group's shared goals and make a positive impact in the Be Well zone. And so the collaborative ensures that the work of Be Well supports the vision and mission, provides leadership and guidance specifically in the development and implementation and evaluation of a Be Well Community Action Plan. Back in 2018, the collaborative established 7 goals to be accomplished in 7 years. The collaborative promotes policies that support the priorities of the Be Well Health and Wellness Initiative. Members serve on work groups. For example, we have a policy committee, a transportation committee, and members provide feedback and make recommendations that support each other's work in alignment with the mission of the Be Well Health and Wellness Initiative. And so Be Well has several programs and efforts that fall in different areas. We have youth initiatives, school wellness. We also have Be Well centers, which offer free and low to no cost fitness and wellness classes. Again, we have a health policy committee, and now efforts focused on COVID-19. And so it is our expectation that through the implementation of these efforts, in addition to our community collaborative, that all of this will lead to our achieving our 7-year, 7-goal community action plan results. And so to support Be Well community efforts, we have partnered over the years with several organizations such as CALC, the Tri-County Health Department, the Regional Transportation District, Marbella 2020, just to name a few. Now, at the heart of Be Well are our Be Well block captains, and they are pictured here. We have both adult block captains, some of who are pictured on the left, and our youth block captains pictured on the right, and they are resident organizers from our communities. They are our volunteer base who are on the ground, knocking on doors, with the intent of engaging their fellow neighbors, families, friends, in advancing policy practices, systems, and environmental changes to eliminate health disparities and to build advocates in our most vulnerable communities. Be Well has established the Be Well Block Captain Community Engagement Model. So our Be Well Block Captains, again, are a group of residents and community stakeholders who can rapidly mobilize around important issues related to the social determinants of health. Block captains identify the issues that they deem important and establish a plan of action to execute. Again, they are on the ground with the intent of improving their health and the health of their community. They meet people where they are, learn what's occurring on the ground. They help them see how their experiences are part of the larger community context, engage others, family, friends, community, and community efforts, collaborate, develop plans, and take action, and help others recognize their own power. And so to increase the capacity of residents that live within the Be Well zone to advocate on their own behalf and that of their family, friends, community members for changes that they want to see, Be Well conducts a Be Well Block Captain training. Again, this is capacity-focused approach that seeks to energize residents to create positive and meaningful change in community. And so we currently have a training that is going on right now. Our trainings consist of a 4-week, 8-session course. So residents meet twice a week for 4 weeks. And this course immerses residents in community health. Upon completion, graduates will be ready to identify barriers to healthy living, understand health disparities, the social determinants, develop solutions, and improve the health of their communities. As you can see from this flyer, some of the topics are equity in education, civic engagement. We talk about chronic disease and prevention, race and economics. Now we know how busy life can be. Folks are pulled in so many different directions. And so we've created a volunteer structure within the Block Captain program that gives volunteers the opportunity to engage at the level that best matches their availability. There are 3 different tiers for serving as a Block Captain that allows for different time commitments. And so the first Block Captain tier is called the Connector, which is basically what it sounds like. You know, people are connecting other people to information, to resources, perhaps to other community members, and they do complete the Block Captain training, but they just don't have as much personal time to devote to Block Captain efforts. The second tier consists of captains, and the expectation for captains is a little more substantial. We do give stipends for this tier, $25 each month, and participants must engage in 8 hours of volunteer efforts. And with that, they provide us with 5 contacts of individuals who may be interested in joining our Be Well program efforts. The third tier are Be Well coaches, which is a bit more engagement and ongoing connection. And for providing 10 contacts, these individuals get $50 gift cards every month. And so during COVID, the pandemic, it was not a requirement to meet with people in person, as obviously that was risky. But our Block Captains did make use of, email, social media, and other forms of communication to engage residents in Be Well Block Captain efforts. To motivate and encourage our Block Captains and contribute to the sustainability of our program, Block Captains are recognized for their efforts annually. During our annual Be Well Awards and Community Celebration. They are highlighted in newsletter articles, given the opportunity to present at community meetings and other professional development opportunities. We also provide incentives when we can, such as refreshments and tickets to events, gift cards, and we are exploring the ability to develop what we call Be Well Club cards, where we partner with businesses, and a Block Captain may be able to go into maybe a restaurant and get a discount off of a dinner or an item at a store. And so as a result of the work of Be Well Block Captains, there have been many changes to the built environment, as well as policy changes. For example, sidewalk improvements around schools, increased pedestrian access, the complete renovation of the Moorhead Recreation Center, establishment of standard partnership policy with the Denver Parks and Recreation, improved RTD store services, just to name a few. And so when we ask Block Captains, what they enjoy about being a part of the program, previous and current Block Captains have stated that through this Block Captain effort, they love that they have a connection to the community and enjoy the opportunity to give back and to learn how to stay healthy. And so now that you are more familiar with Be Well and the Be Well Block Captain program, again, which is our volunteer base, let's talk about COVID-19. And as you all know, during the pandemic, particularly in 2020, there were higher rates of COVID cases and deaths reported among people of color. And this graph illustrates the 2020 data from the Colorado Health Department. As you can see, among the Hispanic and African American population, there are higher cases of COVID in orange compared to percent Colorado population, and even more deaths in blue, and particularly more deaths in the African American population compared to the Colorado population, which is indicated in gray. And so when we look at data across all states, a similar trend was observed, where the color orange represents significance in deaths and cases of COVID-19, and green is less deaths and cases. And as you can see, the first row, we see African Americans represented on the first row had higher rates of deaths compared to Hispanic and Latinos. When you look at the first column, due to COVID-19, indicated by the intensity of orange across all states, and both Hispanic and African American had higher cases. And again, this is 2020 data. And so before COVID, most of our strategies were dependent on, the ability to have face-to-face interaction, that one-on-one interaction. People were going to Little League practices. Our block captains and staff, we met others at bus stops. We would host healthy happy hours as a fun way to promote health and engage others in health advocacy work. We went to churches and schools, just showed up at the grocery store and talked to people, passed out flyers, did door-to-door outreach. Also, word of mouth was a good engagement strategy, and just made and shared the participation of the Be Well Block Captain program and Be Well efforts in a simple way. And we were also open to community suggestions on how they wanted to be engaged. On the left is one of our block captains, some of you may know, and that is Christian Stewart. And so the challenge, COVID-19 deeply disrupted the way we function as a society, and exacerbated inequities from healthcare access to education and economic security. And this quote is from the CDC: "The pandemic has brought social and racial injustice to the forefront of public health. It has highlighted that health equity is still not a reality, as COVID-19 has unequally affected many racial and ethnic minority groups, putting them more at risk of getting sick and dying from COVID-19. And so while we understood that it was a time when we, had to be physically distant to stop the spread of COVID, we knew that we must stay socially connected to continue to strengthen the ties that bind our communities. And so when we looked at solutions to how we would engage and stay connected, we did pivot in response to COVID and wanted to develop strategies to support those disproportionately impacted by the virus. And so we surveyed residents in spring of 2020 on how COVID-19 impacted their lives, and asked what were their most pressing needs, and then implemented several strategies to address those needs. So some of the key activities were first to implement a phone tree where Block captains checked in with other individuals, again, by phone, email, social media platforms, text messaging, other unique communications channels. And in doing so, we continued to reward Block captains with those $25 and $50 gift card incentives. And we also implemented the phone tree where we assigned a group of residents to individuals in their neighborhood or that lived within the BWell zone. Each Block captain received 5 individuals' names and contact information to contact within the BWell network. And they also had the option of contacting, 5 additional people. And then that information that they received was given back to us. They asked questions like, how have you been feeling? How is your family? Are there any necessities you need that you can't provide for yourself at this time? We also shared with them and encouraged them to participate in some of our virtual webinars. And again, we collected those contact logs and information, and continue to follow up with those individuals and check in on them. And so as a result, Block captains connected with 40 community members. We also shared with the participants information regarding the census, because the census was happening during that time. There was a lot of misinformation. So, we wanted to address that and encourage individuals to complete the census, and provided guidance on how to fill out the survey. And through those efforts, we followed through on many of the requests that were made and were able to strengthen trust in community. So here's just an example of the phone tree. Our team lead split the Block captains up, and each gave them contacts, and they, followed up with those individuals by phone and checked in on them. So we also implemented a COVID gift card program to help individuals who were suffering financially. To be considered for support, individuals had to complete a short questionnaire describing how they were directly impacted by the crisis, and demonstrate loss of wage, or perhaps someone in their family that lived with them, in which they depended upon, lost their wages or lost their job. Some individuals, needed food. And so those funds were distributed to residents within the BWell zone. And we distributed over 100 gift cards at $50 each, and leverage our partnerships in order to provide food and increase access to food by partnering with the food bank for our residents. We also created a disadvantaged minority and women-owned business relief grant fund for small businesses. There was a huge impact from the pandemic on businesses, but small businesses, particularly minority and women-owned businesses across our target neighborhoods, had to make challenging decisions whether to stay closed or reopen, and how they were going to survive. And so our goal was to support as many businesses as possible through the resources that we had. And so we launched this effort and distributed 31 grants to small businesses devastated by COVID. We also initiated a BWell Live virtual conversation using a Zoom platform, one, to provide accurate and current information on COVID-19, and to allow for some candid conversations about folks' mental health. And we also discussed the disproportionate effect of the virus on communities of color. And we were able to keep our volunteers engaged. They had the opportunity to speak directly to experts through this platform. And so we engaged over 200 community members through this series. We did one on dismantling racist systems. We hosted a virtual movie about the film, or watched the film Crash, to continue the conversation on racial injustice and how it corrodes every aspect of life. We had about 60 in attendance to that event. And so volunteers, stated that this helped them remain engaged and navigate during a very difficult time. This series, again, we could go outside of the state because it was a virtual platform to get national panelists to provide details and answer questions related to the medical, economic, and social impacts. And even if you didn't have a Zoom or, access to Zoom or a computer, you could still conference in by phone. And so that was a very successful activity that we conducted during the pandemic. We also conducted COVID-19 testing events in collaboration with the city and state, and partnered with other community-based organizations to reach underserved Denver communities. We organized vaccine clinics, particularly with the churches, to reach residents in neighborhoods with less access. And so we hosted 8 testing sites, distributed 3,000 masks to community members, and hosted about 20 vaccine clinics in partnership with churches. In Northwest Aurora, we hosted COVID-19 information sessions to ensure that predominantly Spanish-speaking residents had accessible and up-to-date COVID-19 information and resources. And as a result, one of the centers we worked with almost tripled the number of individuals in the community that they serve who understood what the virus is, how it spreads, and why it was important to get the vaccine. And so I'd like to show this brief video of our Block captain who participated in this effort.
My name is Mateos Alvarez, and I represent the neighborhood of East Colfax and Dayton Street. The way I would describe Be Well in our own experience here at the Dayton Street Day Labor Center is that Be Well has provided us with technical assistance, it's provided us with resources, and it's provided us with some coaching to help our work move forward in a very human way and a very personable way that we don't always get from larger types of organizations. Be Well is invested in our particular community and has been for a long time, and it shows by the amount of support and time they provide to our organization. So the reason why I became a block captain is because of the pandemic, the COVID-19 pandemic. We were very worried about our constituents on Dayton and Colfax, and we're struggling to figure out how to get people vaccinated. And Be Well was the first entity that was there to help us navigate how to get vaccines to our people here on Dayton and Colfax, so much so that we were connected to the governor's office and connected to Tri-County Health through our coach from Be Well to be able to host clinics at our location here on Dayton and Colfax. Well, I decided to get vaccinated as a block captain because I want to protect myself, I want to protect my family, and I want to protect my community. I'm also the executive director of an organization on Dayton and Colfax, and we have a large amount of immigrant and refugee and members of the community that come through our network, through our location. And the more people who get vaccinated, the better. And by me getting vaccinated showed others around me that it was okay to get vaccinated as well. We're all in this together.
So that was a great opportunity to partner with that particular organization. You know, even though there was a lot of information being shared on the news and in newspapers, it was not getting to that particular community. And so we were able to connect them to Tri-County Health. They ultimately hosted their own vaccine clinic. And so it was just a great partnership and effort. During that time, we also offered a variety of free helping living services virtually. We tried to continue our Be Well centers virtually to assist residents with maintaining their mental and physical health during that time, which is important to reducing the spread of COVID. You know, your well-being helps you boost your immune system, which helps your body combat viruses. And so we continue to offer health and wellness services. And, you know, staying positive was just really difficult early on with, you know, so many unknowns and folks losing relatives, being ill themselves, so many deaths, the job loss. And so many people were impacted and challenged with staying positive. You know, how do you cope? And even though we as Be Well didn't have all the answers, we tried to do our part to help others release stress and build their mental and physical strength through our Be Well centers and through the courses that we offered. And so we went from in-person to providing 65 virtual fitness and wellness classes in the community across all ages, in a variety of settings, partnering with schools and churches, courses for youth and adults. And so the outcome of all of that was that Be Well Zone residents had increased access to concrete financial support, up-to-date information and accurate information on COVID-19, access to COVID testing and vaccines and masks and mental health support, which we believe tangibly contributed to decreased community spread of COVID and the health and wellness of Northeast Denver and Northwest Aurora residents disproportionately impacted by health inequities. Some of our challenges, you know, we lost a lot of volunteer involvement and had less retention, but we continued to follow up with our residents and stayed in touch to maintain as many relationships as possible and provided needed resources based off of the information that we received. Though we couldn't meet face to face, which was a challenge, we implemented a virtual platform. And while many lacked access to technology and digital literacy, which was a challenge, we contacted folks by phone. And whatever we did virtually, we made sure that individuals could access it by phone. And so while we had our 7 goals and community action plan based off of the information we received from community, we needed to shift focus because, you know, individuals needed assistance with just simple basic needs, food, job opportunities, housing, COVID education. And so because of our framework, we were able to shift and pivot. We had that flexibility while, you know, some organizations stopped all of their volunteer efforts. We also had some communication barriers. You know, we tried to do everything offering Spanish translation, again, hosted webinars with experts and managed misinformation. And unfortunately, we did have to cancel our annual recognition event, but we did reschedule it, and that will take place April 28th of this year. So some of the lessons learned, you want to make sure that you are hearing community concerns and that communication is a two-way communication, that you are listening with a blank slate. Community conversations should include a wide variety of stakeholders and not just community champions. We made sure that we engage those most directly affected by inequities, and as well as trusted community leaders. We recognize the importance of using various communication methods when sharing information, the virtual platforms, as well as, putting information in multiple languages, making phone calls, sending emails, websites, all of these various communication methods. We had to shift from the one-on-one to make use of all of these other methods. We also learned the importance of leveraging our networks and getting essential information and resources. A lot of folks were, pushing COVID-19 information, and instead of duplicating efforts, we connected our residents with those organizations. It was important to actively respond to false information. There was a lot of rumors. It was important to proceed with compassion. Again, so many folks were dying, unfortunately, and having just significant losses. We still tried to build leadership capacity, and also to try to incorporate some fun, and definitely compensate individuals for their contributions, be it financially or in kind. And so in regards to community resilience, we know that community resilience is individual and collective capacity to respond to adversity and change. And through Be Well, we were able to create space for residents to still come together to generate their own short-term and long-term solutions to problems that they see in their community, and thereby contribute to community resilience. Listed here are some critical elements to community resilience. First being the people. The people have the power to envision the future they want to see for their community. Another foundation is having a good quality of life, which is connected to access, right? Access to affordable housing and quality and affordable healthcare, behavioral health, social services, employment, and education. When people have good quality health, or good quality of life, this increases their capacity to be resilient, and thereby increases capacity of community resilience. Also, the involvement of organizations, both governmental and non-governmental, in planning, response, and recovery. It needs to be integrated. There's a need for stronger relationship with community and community networks before disaster strikes. And so there were a lot of relationships that were formed due to the crisis. And so I think going forward, we want to figure out how to nurture those relationships and continue those relationships. So when the next crisis comes, that, we can adapt to that situation. And so adaptability is also important, as well as systems thinking, because we know that systems thinking is going to have a longer impact. And so even with the organizational relationships, non-government and governmental, who is leading these organizations is important in this integration. And when we talk about the role of data, I think generating data on, again, what were the gaps during the crisis? How can we prepare better? What were the physical resources or natural resources that we were able to draw on, or we weren't able to draw on, will better prepare us for anything that comes in the future. And so as far as the future work of Be Well, we will be establishing Be Well centers in local Northeast Denver affordable housing complexes to allow organizations to provide in-house support services to residents on a regular basis. We are looking to provide wraparound services that are family focused and equip families with knowledge, tools, and resources to recover from the impact of COVID. And these efforts are funded by CDPHE. And so with that, I want to acknowledge our team. Those names are listed before you, as well as our director and senior vice president of the foundation, Alicia Brown, who the Block Captain program was her brainchild. And for more information on Be Well, you can visit our website at www.bewellconnect.net. And with that, I will be happy to answer any questions. Thank you.
Thank you so much, Dr. Harvell. I feel like you touched on every single theme in our conference, from the pandemic, the resilience it took for communities to withstand this, and how do we imagine a new beginning. So thank you so much for that energizing talk. We have a couple questions that came in through the chat, and Nikki was wondering if what is your homeless population in the Be Well community areas? And just wondering if you have any suggestions for innovative ways to encourage vaccine and testing with this population.
Thank you for the question, Nikki. I do not know what our homeless population is from a numbers standpoint. We do partner with the Colorado Coalition on Homeless, and I would connect you to them to get more information on the questions that you are asking. It says, we are looking for innovative ways to encourage vaccine testing with this population. My advice would be to meet people where they are. That is the best thing in as far as what we observe, which is why we went in community, went to the churches where a lot of folks convene, went to the parking lot of Sam's Club and Walmart and hosted COVID testing there. And so I would just try to set up situations where you can meet people where they are.
Oh, great. And then we had a question from Elena, who wants to know if you could talk a little bit more about developing the community building training and how you determine the curriculum for these training sessions.
As far as the curriculum, we just got together with some of our staff and our block captains to look at where our training was at the time, and what was going on in society at the time, and with everyone's input decided to add more around race, and came up with the dismantling racist systems content. And so just from experience and engaging community, and a lot of our staff have lived experiences. Our staff reflects the community that we serve. And so it was tapping into all of that knowledge that allowed us to determine the curriculum, and then through our relationships with other partners, develop the experts that would conduct those trainings.
Oh, great. And I'll give people some more time to kind of think of questions. One question I had was just wondering what state Be Well is at in terms of the recovery process from COVID. It sounds like you guys are starting to introduce more in-person programming, and just wondering if you're still, or if you're kind of doing hybrid services at this point, and what that looks like.
Yes, we are beginning to meet in person. I believe I stated earlier that block captain training that is going on now is in person. We are also looking at the hybrid option because we're not sure that everyone is comfortable meeting in person right now, but we know that we are most effective when we can meet in person and have that one-on-one interaction. And so since things seem to be opening up now, we are giving it a shot, including with our Be Well centers. We are in May going to launch those, and they will be in person as well. And so we'll just test it out. And, you know, if we have to adapt, we will. And that option would be probably to go hybrid, and then if need be, go back to the virtual platform entirely.
Oh, yeah. You guys are just demonstrating flexibility left and right. And
Yes.
then a question. Block captains can potentially serve as community health workers. It seems like their functions closely aligned. Has there been any consideration to provide community health worker training to block captains?
I think prior to me becoming a part of the organization, there was some consideration for that. I can definitely take that information back so that we can discuss it, but going forward, we have not discussed that at this time.
Oh, yeah. And I just had another question too. One of your lessons learned was to try and incorporate more fun. Yeah, can you just elaborate a little bit on what kind of activities you found like brought like fun and spontaneity to your program?
Yeah, well, we tried to meet outdoors. Like we were going to plan our annual event in the parking lot of one of the RTD parking rides. And we were going to bring in a big screen where, you know, you could just park in your car, kind of like a drive up movie scenario. But unfortunately, we got rained out.
Oh, no.
So, you know, in thinking about our events and when we get together, you know, like we had the movie night, just adding you know, happy hours where folks can just relax as we promote health, but also kind of just relax and, you know, have a little bit more fun during these trying times.
Oh, that's great. Yeah, I feel like it's just nice to be able to have a balance, and sometimes those kind of activities are just exactly what people
Yeah.
need, and also
And some of,
promoting.
yeah, and you know, in the virtual setting, you know, some of it is through icebreakers, things of that nature to take folks' mind off of what's going on with them, you know, in that moment, so that they can fully be present and, you know, just let their hair down. So I would say icebreakers is another means as well.
Oh, that's great. Yeah. Um, yeah, I guess I'll give people a couple more minutes to think of some questions.
Yeah, and Allison, I'll post my information in the chat if anyone wants to talk offline about some of their questions or suggestions or recommendations for us as well. So I will put my contact information in the chat. Please feel free to contact me. We also have our Be Well Awards and community celebration. So if you're interested in attending that, I can get you that information as well. We would love for you to join us.
Oh, that's great. Yeah, because we have so many people who are living in the Denver metro area who really could get involved with Be Well. So that's a great suggestion. Yeah. Well, thank you again. And we're just about time where we need to start wrapping up. So I wanted to thank Dr. Harvell again for giving such a comprehensive talk about your organization and your efforts. It's very remarkable how adaptable and flexible you guys have been throughout all these challenging situations. Thank you for attending all the session today to attendees. We have slides and additional handouts that are posted on the Sketch website. And wanted to let you know that you will also receive a conference evaluation form via email after the conference is over. And we're encouraging you to fill that out. It gives us really great feedback about how to make this conference even better for next year. And you will also have the opportunity to enter into a raffle to win one of two $50 gift cards. And we are going to, at the end of this session, we will have a 15-minute break, and the next live session will start at 10:15. And this is another concurrent breakout. And you can see the full schedule on the Sketch Conference website to determine which breakout you want to attend. So thank you all again. And thank you, Dr. Harville.
Thank you. Thank you for the opportunity.